Sleep apnea impacts every facet and every condition and health and well-being.
It is one of the biggest problems facing the developed world today.
It really affects every single organ system in the body.
Things like cardiovascular issues, high blood pressure, heart failure, stroke, arrhythmias, irregular heartbeats are known to correlate with significant sleep apnea.
Sleep apnea is right up there with coronary artery disease, diabetes as a real predictor of early death.
In the US alone, the numbers of sleep apnea patients are well over 20 million. The likelihood of prevalence of disease is probably in the 20 to 25% of all adults in the 30 to 70 year range. And this is extraordinarily expensive to the American economy. It's estimated that the cost of treating sleep apnea is in the $10 to $15 billion range, and the cost to the economy for economic slowdown associated with untreated disease is in the hundreds of billions of dollars.
A significant proportion of the population fall into the category of having sleep apnea and not knowing that they actually have sleep apnea.
Right now you've really got two avenues of treatment for most patients with sleep apnea. There's the traditional CPAP machine, which works very well if it's used properly and if the patients are compliant, although compliance rates with CPAP can be generally very, very low.
A lot of patients just don't want to have to wear a mask at night. And that has played out in its failure to really get ahead of this problem.
Is trying to treat disrupted sleep by actually being a disruption to sleep.
And then you've got surgical correction for sleep apnea, things like, for lack of a better term, just carving out the posterior portion of your airway, which is incredibly painful and comes with it a lot of other risks.
The future of sleep apnea treatment is non-invasive therapies. It's something where, in general, medicine is moving in that direction. And so if a therapy becomes available that is non-invasive, easy to do in the office, that people will take to very well, that's always going to be a game changer.
So the idea of something that uses like vibroacoustic stimulation to grow my stem cells and expand my airway is a lot more palatable than anything that's been mentioned, especially if you approach it from the direction of this would represent removing the disease, not just managing its consequences.
So far, I have reviewed 71 charts of dentists integrated into VIVOS that have collected baseline or pre-treatment sleep studies and comparing that to either mid-treatment or post-treatment sleep studies. And that was a snapshot in time. And from those patients, which came from 7 separate dentists, 80% of patients improved. And by improvement, I mean that their AHI, ODI, and RDI dropped roughly by 50%. So that is quite profound.
The apnea-hypopnea index is a way we quantify how many times per hour the patient's airway obstructs or collapses. And I've seen the numbers go down by 50% or even better. Dr. Haidt has patients where their sleep apnea has been cured or completely resolved by the use of a VIVOS appliance.
The DNA appliance is currently more effective at treating sleep apnea and relieving maxillofacial pain than anything currently on the market. And obviously we're going to be rolling that out through much more appropriate, rigorous study to test it. But at this point it appears safe, and it appears effective, and it appears well tolerated. And that's a clinician's dream.
It is a cure in the sense that it decreases the apnea-hypopnea index to less than 5 or less than 1, which is cure by treatment.
I think this is a device with a lot of promise. I'm an academic physician, which means I'm a natural skeptic. So I do like devices that have good biological plausibility, which this device does. I'm very excited to see more clinical trials being done, and as I know they are being done. But I like the idea that there may be a third avenue for treatment for sleep apnea, which is why I'm fascinated with where this device is headed.
It's going to be really exciting to educate people on the different ways this can be used and continue to research all the different benefits we might get from it, because it's clear that there's more than just simply not snoring.
As the scientific evidence for the VIVOS device builds, I think we could potentially have a viable alternative or adjunct to CPAP because this is treating the disease in a different way, and it may, if not be the magic bullet, it may be a major component of treatment for sleep apnea.
That could result in some massive cost savings from our healthcare system, money that could be put towards things like education and lots of other ways that can add to people's daily, day-to-day happiness on top of simply what sleeping well would do.
It would be something that I think would, on a global healthcare scale, would be completely revolutionary.
Oh, it could change the world.